Let me tell you what happens in aneurysm. Now, the most common cause of an aneurysm is atherosclerosis. The most common cause of an aneurysm is atherosclerosis. Overall, like overall. If they ask you what's the most common cause of aneurysm, that's atherosclerosis. ATH. Okay. Actually, atherosclerosis is the most common cause. Now, if young people in young age for aneurysm, the for an aneurysm, be it berry aneurysm or be it other aneurysm, in young age, it's mostly genetic, congenital vessel weakness, congenital weakness of vessels, like in Marfan syndrome or Ehlers-Danlos. If they ask about the cause of berry aneurysm, atherosclerosis due to hypertension or other causes, mostly hypertension, 90% case. Now, when I describe the pathology, we'll be very sure about it. Now, what happens in older age or anyone having hypertension? The endothelium gets injured frequently. And what happens after that? Whenever endothelium is injured, endothelial activation occurs. Endothelium shrink injured endothelium release TNF alpha. This TNF alpha will cause endothelial activation. Now here in blood we have monocytes, lymphocytes, and other things, but here monocytes come to play. Monocytes enter. This is intimal endothelium. They enter into subendothelial space. Subendothelial space. The moment it enters subendothelial space, it becomes macrophage. Now, this macrophage will engulf lipid particles. This is injury theory. We also have other theories, like I told you previously. Here we have, let me tell you, LDL. LDL is the reason. LDL is the reason. Oxidized LDL. Lipids like LDLs. Oxidized LDLs are taken up by macrophage and they become foam cells. Foam cells. So what happens in subendothelial layer? We have monocyte, and then we have macrophage, then we have foam cells. Now, from media, the smooth muscles of the media, they migrate here and proliferate around these foam cells. Now what happens? Here we have monocyte, macrophage, and we have foam cells, and we have this smooth muscles from media. And this is an atherosclerotic plaque. Now what happens? Here we have a plaque. Here we have an atherosclerotic plaque. So in larger vessels, here we have blood, and how does these layers receives nutrition? See, by simple diffusion, the first one third is covered, but for the rest of it, as it's big wall, we have vasa vasorum. These blood vessels that supply blood to the rest of the area of the large blood vessels. Now what happens? This area is blocked by this plaque. Now what happens? We don't no blood supply in this area, no blood supply in this black area, no blood supply in this black area. So what happens? This area gets under necrosis. This area gets necrosed. This area gets damaged. So what happens? This area of the vessel wall is weakened. This is our medial layer, just medial layer. This has elastin. Elastin maintains the elastic strength. you exert pressure, it goes inside, then it comes back outside. That's the elastic strength given by elastin. And collagen maintains its integrity, like tightness. Tightness. So collagen will make it tight. So it will give tensile strength. So it does not expand due to pressure. So it will hold together. Collagen will hold all the things together. Meanwhile, elastin, like a rubber, it will adapt to the pressure. So what happened here? Here we have both damaged: elastin damage, collagen damaged. Elastin, collagen, both damaged. Now what happens whenever blood gives pressure? Like if the person has a BP due to hypertension, it's happening, right? Hypertension and increased cholesterol level, of course, increased cholesterol level, LDL mainly. So BP, let's say this person's BP is 190 by 120. Now what happens? This pressure, this area will be able to bear the pressure, but this area will not be able to bear the pressure. So what will happen? This area will bulge out like this. That's why I always say this is just a vessel. So all three layers will bulge out. All three layers will, because all three layers are damaged, bulge out like this. So this is an U-shaped area that we call an aneurysm. So most common cause of aneurysm is hypertension. Hypertension or atherosclerosis. Mostly atherosclerosis. Hypertension causes injury and lipid causes atherosclerotic plaque. Most common cause of aneurysm will be atherosclerosis. Atherosclerosis. In all age groups. All age groups. All age groups means overall. Most common cause of berry aneurysm. Check the age. If it's 50, then then of course atherosclerosis. And if it's around 20, 30, of course, at this age, most common cause will be genetic. Remember it. Most common cause would be genetic. And leading risk factor. Remember, modifiable. One thing only, smoking. There are others too, but for revising, modifiable, smoking, that's most commonly asked in exam. Non-modifiable, age. According to composition of the aneurysm, we have only two types: true aneurysm, false aneurysm. You need to know something about it, that in true aneurysm we get all three layers damaged or weakened. Now I will tell you the causes of weakening, don't worry about it. In false, it's not really an aneurysm, it's a hematoma. How? Like intravenous drug user, during using the drug, they puncture a vessel, and what happens? We have blood inside the vessel, and this blood collects here. To stop the blood, to stop the blood, what happens? A fibrous layer is formed around it, and that's we can mistake as aneurysm. This is a U-shaped area too, but this is not a true aneurysm. We have no, we don't have three layers of it. Three layers are here. There's a puncture and it's just a blood clot here. It's just a blood clot here. So that's a false aneurysm. False aneurysm is just a clot covered by fibrous covering. Fibrous covering. So you need to know it. Now you know it. So you know that it can be painful as it's over an artery. It can be pulsatile. Now, cause trauma, intravenous drug user. Trauma with the needle. Most common, intravenous drug user. They will ask you that what will you do? You do compression ultrasound. Like as it's a blood clot, you compress it during ultrasound. You compress it very hard. Compress it hard and it will break down. If not, then give a thrombin injection. If not, then stent. According to shape, It can be saccular, it can be fusiform, and it can be some other types too, but we don't need it. They don't ask it in your exam. Remember, fusiform is the most common type of aneurysm, and most common site would be abdominal aorta. Mostly it happens at infrarenal region. Note it down. These will come in your exam. You have it in your arrows, but note it down. So this is very important, guys. You will have 7 to 8 questions from vascular surgery. 7 to 8 mostly. These goes under pathology. Remember three types of aneurysm according to, like, what did I tell you, that weakness or destruction of vessel wall, right? That's the mechanism. Now we know it that if an aneurysm is formed due to atherosclerosis, we will call it atherosclerotic aneurysm. Now there are some other things too that can cause aneurysm. Number 2, lutic aneurysm caused by syphilis. Syphilis can cause your vessel wall weakness too. So that aneurysm will be called as lutic aneurysm. Syphilis organism is Treponema pallidum. Treponema pallidum. Number 3, mycotic aneurysm. Any bacteria, any virus, any fungus, whatever you say it, mycotic doesn't mean fungal infection. Mycotic doesn't mean fungal infection. Mostly it's caused by bacteria. So it's a misnomer. Remember it. It's a misnomer, but mostly it's caused by bacterial infection. Bacterial infection. So the aneurysm that is caused by bacterial infection will be called mycotic aneurysm.